In this podcast episode, Dr. Stephen Gundry, a cardiologist and medical researcher, shares his journey from being a renowned heart surgeon to becoming a pioneer in nutrition and gut health. He recounts a pivotal moment in his career when he encountered a patient nicknamed Big Ed from Miami, Florida. Big Ed had been diagnosed with inoperable coronary artery disease, but managed to reverse 50% of his blockages in just 6 months through diet changes and supplements. This experience led Dr. Gundry to revisit his undergraduate thesis from Yale, which explored the idea that manipulating a great ape's food supply and environment could essentially derive a human being. Inspired by Big Ed's case, Dr. Gundry decided to apply his own thesis to himself. At the time, despite being a top heart surgeon, he was 70 pounds overweight, suffered from various health issues, and was told it was all genetic and normal for his age. By changing his diet and incorporating supplements, he lost 50 pounds in the first year and saw dramatic improvements in his cholesterol levels, blood pressure, and overall health. This personal transformation led Dr. Gundry to make a significant career change. He resigned from his position as a heart surgeon and set up a clinic in Palm Springs, focusing on teaching patients how to eat to avoid heart surgery altogether. This shift allowed him to observe remarkable improvements in his patients' health, not just in cardiovascular markers, but also in other areas like joint pain and overall well-being. Dr. Gundry gained widespread attention with his book, The Plant Paradox, in 2017, which introduced many people to the concept of lectins in plants and their potential negative effects on human health. He explains that plants and animals are in a constant state of biological warfare, with plants developing compounds to deter predators from eating them or their offspring. Humans historically had robust defense mechanisms against these plant compounds, including stomach acid and a diverse gut microbiome. However, modern factors like broad-spectrum antibiotics, glyphosate, and proton pump inhibitors have compromised these defenses. The discussion touches on how certain plants, particularly grains and beans, were not part of the human diet until the agricultural revolution 10,000 years ago. The introduction of these foods coincided with a significant reduction in human height, which Dr. Gundry attributes to the effects of lectins. He explains the mechanism by which lectins can damage the gut lining, leading to increased intestinal permeability or leaky gut, which in turn can trigger chronic inflammation and various health issues. Dr. Gundry emphasizes the importance of gut health in overall wellness. He describes how the human gut has a surface area equivalent to a tennis court, but is only 1 cell thick, making it vulnerable to damage. The tight junctions between these cells can be compromised by lectins, allowing foreign particles, bacteria, and undigested food to leak through. This triggers an immune response, which, if chronic, can lead to ongoing inflammation and various health problems. He discusses how the immune system develops memory for these foreign particles, creating a state of constant alert in many people due to regular consumption of lectin-containing foods. This chronic immune activation is measurable through various inflammatory markers like C-reactive protein, fibrinogen, and specific interleukins. An interesting connection is drawn between oral health and cardiovascular disease. Dr. Gundry shares his early research showing that regular flossing could significantly reduce C-reactive protein levels. He explains that the same bacteria causing tooth decay can be found in cardiovascular plaques, highlighting the systemic nature of inflammation and the importance of oral hygiene in overall health. The podcast touches on the controversy surrounding the connection between oral health and other bodily systems, with Dr. Gundry firmly asserting that there is indeed a strong link, contrary to some fact-checkers' claims. He cites evidence of oral bacteria being found in coronary artery plaques and discusses a study where low-dose antibiotics effective against oral bacteria reduced coronary calcium scores. Dr. Gundry challenges the traditional view of LDL cholesterol as the primary driver of heart disease. He discusses how statin drugs, while lowering LDL cholesterol, also have anti-inflammatory effects that may be more significant in reducing cardiovascular risk. He cites recent studies using low-dose colchicine, an anti-inflammatory drug, which showed additional risk reduction in patients already on maximum statin therapy. These studies revealed that the reduction in C-reactive protein, CRP, rather than LDL levels, correlated with improved outcomes. This information, according to Dr. Gundry, should have been groundbreaking in shifting the focus from cholesterol to inflammation in heart disease prevention. However, he suggests that the financial interests in statin drugs may have overshadowed these findings. Dr. Gundry provides dietary recommendations based on his research and clinical experience. He advocates for grass-fed, grass-finished meats, but with an important caveat. He explains the presence of a sugar molecule called Nu-5GC in beef, lamb, pork, and milk, which humans don't naturally produce. Our bodies make antibodies against Nu-5GC when consumed, and it can substitute for a similar molecule, Nu-5A, in various body tissues, potentially contributing to inflammation, cancer growth, and other health issues. Interestingly, fish and poultry contain Nu-5AC, which is compatible with human biology. Dr. Gundry suggests increasing consumption of these protein sources. He also notes that fermentation processes can eliminate Nu-5GC from dairy and meat products. Traditional fermented sausages and certain cheeses, for example, don't contain Nu-5GC. He mentions an exciting development where a producer named Jimmy Schmidt has received USDA approval for lowered Nu-5GC beef and hot dogs through a fermentation process. Throughout the podcast, Dr. Gundry emphasizes the value of fermented foods in promoting gut health and reducing potential harmful compounds in foods. He explains how fermentation can transform potentially problematic foods into beneficial ones. For instance, quinoa, often touted as a health food, was traditionally fermented by the Incas before consumption, a practice not commonly followed today. He shares personal anecdotes about his patients and family members experiencing improvements in skin conditions and overall health when incorporating fermented dairy products and vegetables into their diets. This approach, combining aspects of a carnivore diet with carefully selected and prepared plant foods, challenges conventional dietary advice while highlighting the importance of food preparation methods in determining health outcomes. Dr. Gundry discusses the potential of certain supplements to address nutrient deficiencies and improve health outcomes. He mentions slow-release niacin as a supplement that can have profound effects on physiological outcomes, particularly in managing lipoprotein A levels, a significant cardiac risk marker. He argues that many health issues are often rooted in nutrient deficiencies rather than inherent disease states, and that providing the right nutrients can lead to significant improvements in health. The conversation touches on the importance of pre, pro, and postbiotics in supporting gut health, with Dr. Gundry mentioning his own product, BioComplete 3, as a tool for enhancing the gut microbiome. He emphasizes the growing recognition of the gut-brain connection in scientific research and how this understanding is reshaping approaches to both physical and mental health. Throughout the podcast, Dr. Gundry consistently challenges conventional medical wisdom. He questions the reliance on statin drugs for managing heart disease risk, the focus on LDL cholesterol as a primary risk factor, and the traditional dietary advice that often recommends low-fat diets and whole grains. His approach, based on both his clinical experience and ongoing research, suggests a more nuanced understanding of nutrition, inflammation, and chronic disease. He also discusses the limitations of certain medical tests and the potential misinterpretation of statistical data in medical research. Dr. Gundry emphasizes the importance of looking at relative risk reduction critically and considering the broader context of health markers beyond just cholesterol levels. The conversation hints at the future of personalized nutrition, with Dr. Gundry's work exemplifying how individualized approaches to diet and supplementation can lead to significant health improvements. He discusses how understanding one's specific health markers, gut microbiome, and response to different foods can inform more effective dietary strategies. The podcast concludes with Dr. Gundry's perspective on what it means to be an ultimate human, which he defines as having the ability to wake up every day with a new question that needs an answer. This encapsulates his approach to medicine and health, one of constant curiosity, learning, and adaptation. Dr. Gundry's journey from conventional heart surgeon to a pioneer in nutritional medicine illustrates the evolving understanding of health and disease. His work challenges many established beliefs in medicine and nutrition, offering a perspective that emphasizes the role of diet, gut health, and inflammation in overall wellness. While some of his ideas remain controversial, they provide thought-provoking alternatives to traditional approaches to health and disease prevention, encouraging both medical professionals and the general public to reconsider long-held beliefs about nutrition and health.